Welcome to Mercy Medical Center's live webinar. Today's topic is helping kids cope, understanding and managing childhood anxiety. Joining us is Ellen Daly, counselor at Mercy's Family Counseling. After her discussion, she will take questions from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be confidential. Well, welcome to the webinar, Ellen. I'm glad to have you here with us today, and I'm going to turn the mic over to you now so we can go ahead and get started.
Okay, thanks so much, Lynn. Just to get us started, I wanted to share some of the sources that helped me to create the webinar, but also some great resources for people to use at their home. So we have National Institute of Mental Health, American Academy of Child and Adolescent Psychiatry, Anxiety and Depression Association of America, Children's Center for OCD and Anxiety, and then I make a little plug too for another resource that I found after I made this slide. Yale University's Child Study Center has a handful of videos available for free on YouTube that address this topic and are really wonderful resources as well. So just a brief overview of what we're hoping to cover in today's webinar. I'd like to take anxiety and break it down a little bit for us to understand from multiple perspectives. Physiologically, in our bodies, and understanding anxiety through our thoughts, our feelings, and behaviors, and specifically for children. And then I want to shift our perspective a little bit and look at facts and frequently asked questions for parents and caregivers. Also focus on considerations for caring for children who may be experiencing anxiety, and some general tips for parents and caregivers as well. Then I have a few additional resources at the end that we'll review. But understanding anxiety can feel complex and complicated. And so part of what we'd like to do today is put together multiple pieces so that we can see the larger picture of anxiety. And it's important for us to look at anxiety holistically through multiple lenses. So again, we have the neurological, physiological, and this is informed through a lot of research that's been published recently through neuropsychology and developmental psychology. Also our cognitions and thoughts, and oftentimes for children these can be conscious and or unconscious. And those thoughts and cognitions then influence our feelings and behaviors. And behaviors are oftentimes the most notable marker for children as ways of communicating their anxiety to us. So if we start through a physiological lens, we know that anxiety is a necessary warning signal of a dangerous or difficult situation. The fight or flight response gets activated in our brain, and it's part of our brain structure for survival. The neurophysiological response happens because we perceive a threat, and our brains actually focus in on that threat, and what I like to say is it's almost like a tunnel vision in terms of how we can, how our brains focus in on that anxiety. So our alarm system becomes activated in our brains and then in our bodies, of course. And this response, the fight or flight response, is deeply rooted in our physiological development. In fact, it's been noted that the limbic system, endocrine system, the amygdala, these are some of the earliest developed parts of our bodies and brain. And it's been noted that at around 6 months of age, those begin developing, actually in the womb. So some of the physiological symptoms of anxiety. We have muscle tension, exaggerated startle response. We may become more easily fatigued. Our sleeping or eating habits may be disturbed. We may find that we're sweating more, have physical weakness, memory disruption, difficulty relaxing, having physically shortness of breath, heart palpitations, upset stomach, and poor concentration. When our fight or flight response is activated, our brains release an increased level of cortisol and adrenaline in our bloodstreams. Conversely, our levels of dopamine and serotonin decrease, and those are chemicals in our brains that help us to feel more happy and calm. So in this physiological activation, I'd like to look at both chronic activation and the impact of that chronic stress response and acute activation. With chronic activation of a stress response, we know through research that there becomes interference with actual brain development. And so this is really significant as we start to think about how anxiety impacts child development and just a child's experience of life in general. With acute activation, our emotions, thoughts, behaviors, those all start to work adaptively to negotiate or mitigate those feelings of anxiety. And that's true, of course, for chronic experience of stress and anxiety as well. Moving on, our thoughts and feelings, as we look at anxiety, impact our overall physiological state and also our emotional state. So our thoughts and feelings are influenced by the activated neurological state that we're already in, of perceiving a threat, focusing on survival. Those all shape our thought patterns. So if we kind of break that down, the thoughts and feelings that are characterized by anxiety are chronic irrational worries that feel like they can't be turned off and also feel difficult to control. Our thoughts become focused on expecting bad things to happen and belief that you don't have the ability to cope. And oftentimes with children, once these thoughts are activated and present, children underestimate their ability to access their ability to cope. So these thoughts and feelings clearly cause significant distress and interference with multiple areas of life, their overall wellness, overall functioning, and they interfere on the child's ability to focus attention on other developmentally important aspects of life. So you can see that the anxiety starts to take a really large presence in the child's mind. And there becomes more of a focus perhaps on scary scenarios, and there become more anxious cues that the child then interprets as threats. Again, if we return to that thought of tunnel vision happening neurophysiologically, our thoughts mirror that as well. So our thoughts may focus then almost, more exclusively on anxiety triggers. But again, I want to just note that this is an adaptive response for survival. So. Here are a few examples of automatic thoughts that are often present with anxious thinking patterns. And in these, there's an overestimation of the probability of risk, that all negative events would become more likely overall in the child's cognitive schema or structure. Some of those examples might be no one will like me, something bad will happen if I do this. So we see patterns of all or nothing thinking, really black and white thinking, catastrophizing, negative self-talk or negative self-labeling, or even mind reading. So the mind we see is primed to that fight or flight response in an elevated physiological state. Often for children, these patterns focus on the well-being of their caregivers and as they age, their peers. Anxious behaviors, if we take a look at this is oftentimes our lens into understanding that a child is experiencing a lot of anxiety. So we may see attempts at perfectionism, There could be social isolation. The child could be resistant to engaging in activities that they normally found enjoyable. In more extreme cases, hair pulling or chronic nail biting. We may also see the child expressing their anxiety through angry behaviors. Again, we see this as part of the fight response. So this is an adaptive way for the child to psychologically make an attempt at dealing with the constant discomfort of anxiety through trying to avoid the anxiety with angry behavior. Now, one of the more problematic behaviors that we see oftentimes with anxiety is avoidance behaviors. And we're going to take a look at this more in the tips for parents and caregivers. But the intent with avoidance behaviors is to escape the anxiety. But what ends up happening with avoidance behaviors is that it reinforces the anxious cycle and keeps it intact. So the more the child avoids whatever stimulus or trigger that's causing them anxiety, the message is being internalized that it is scary, that the child can't cope with it. Oftentimes, some other anxious behaviors we might see is the child having a preference for repetition or even a heightened need for control. Okay, so now that we've sort of broken down looking at anxiety from multiple lenses, let's take a look at some facts for families and caregivers about a child who's experiencing anxiety. So let's take a quick look at several of the anxiety diagnoses that children can struggle with. And as a note, this is not a comprehensive list. These are just 3 diagnoses that I thought could be helpful in our discussion today. Separation anxiety is defined as a fear of separation from the child's caregiver, generally their primary attachment. The child may worry significantly about bad things that could happen to their caregiver or themselves, and oftentimes these fears will arise at bedtime, or the caregiver may notice them starting to come out when the child begins maybe daycare or school. Phobia is an anxiety disorder that is categorized by a persistent fear of an object or situation, and the child will make great attempts to avoid this object or situation that is disproportional to the danger posed by that experience. Generalized anxiety is I think what we often see with children, and that it's sort of a sneaky anxiety. It's characterized by persistent worry, chronic somatic complaints, so tummy aches, headaches, that nail biting could also come up, sleep disturbance, and oftentimes these symptoms overlapped with depression diagnosis as well. The child could be described as a worry magnet, where everything feels like a worry. It feels very difficult to control their worries, and they often show reassurance-seeking behaviors. So causes of anxiety disorders in children is again a complex and complicated thing to explore. That we do have evidence, we know from empirical research, that includes number 1, genetic components, genetic influences. So if a child has a history of anxiety disorders in their family, the likelihood of them having that experience is high. Neurobiological influences, including the child's temperament, and family influences and interactions, which we'll take a look at in in the next few slides with family systems and family dynamics. And just to clarify, I think we are still working in the field to understand causes of anxiety, and there are many questions left unanswered. So if we take a look then at how can we treat anxiety disorders for a child, that we have at the first line of defense counseling or psychotherapy. To note that there is hope in helping children manage anxiety, that treatments have been proven effective in addressing these struggles for children. So some of the treatment approaches that we'll take a look at today are cognitive behavioral therapy. Those are cognitive behavioral therapy, or CBT, is noted as effective and evidence-based treatment that decreases anxiety symptoms and helps children to learn more coping skills for anxiety, and also helps their parents to learn more coping skills for anxiety. Play therapy is another approach. Oftentimes with a younger child or perhaps a less verbal child, this is a safer approach for them psychologically, that they communicate through their play and that they could learn their coping skills through play as well, process through their anxiety and simultaneously learn coping skills for the anxiety. Family therapy is very important in the treatment of anxiety. Oftentimes we can isolate the problem within the child, but that it's really more of a systemic, if we take a more systemic perspective, treatment can be much more effective, and that it's very important for the family of the child or caregivers of the child to be engaged in that child's treatment. Medications have been proven effective and can absolutely help with symptom management, and oftentimes we like to see that go hand in hand with counseling and psychotherapy. If we could just look at cognitive behavioral therapy a little bit more, just to clarify for people. CBT's focus is on acquiring and increasing coping skills for better regulating anxious symptoms. So at the core, what we're doing is helping a child to build an imaginary toolbox of coping skills. We want this to be very child-centered and child-focused, and encouraging the child to use their imagination to build that toolbox. How can they fight their sneaky fears, or maybe not so sneaky fears? Physiologically, with cognitive behavioral therapy, we would focus on relaxation and breathing activities and exercises, and then also focus on that child's cognitions or thought patterns. So what we would do is approach that through cognitive restructuring, helping the child to identify anxious thoughts, perhaps asking more questions about the accuracy of that child's fears, and then help the child to create alternative hypotheses or endings to compete with those anxious thoughts. The next level will be then addressing the child's behavior, and this would be gradual and slow through a supportive exposure and desensitization for that child of the things that cause them anxiety. So at the core, again, we are wanting to challenge avoidance behavior, both of the child and of his or her caregivers. A few more considerations then for parents and caregivers of children who experience anxiety. Research confirms that parents of anxious kids, who often suffer from anxiety themselves, are more attuned to their child's anxious behavior. This is a strength. This is an absolute strength, that if a parent can be more attuned to their child's anxious behavior. But I want to note, too, that diagnoses of anxiety disorders in children is 2 to 4 times more likely if that child's parents or caregivers experience anxiety or have an anxiety disorder themselves. So some behavioral red flags that we might see in a child who is experiencing significant anxiety enough for intervention and treatment. Major mood changes, intense feelings that are difficult to manage, interruption in daily life activities, so eating, sleeping, or self-care. And in older children or adolescents, in extreme cases, we might see more self-harming behavior, suicidal ideation, substance use, an increase in aggressive behavior, or an increase in isolating behavior. And I want to really emphasize this last bullet point. And this is a recommendation by Dr. Manassis. He's the author of Keys to Parenting Your Anxious Child, which is a wonderful resource that I would recommend to people. Is that one of the best things that parents or caregivers can do for their anxious child is to get treatment for their own underlying anxiety disorders they may have themselves. So really, again, if we go back, and one of the resources I mentioned at the beginning was the Yale University Child Study Center. In their research presented to the public and professionals, they very much emphasize the importance of looking at pediatric anxiety as part of the family system. That the child may be the one explicitly experiencing the anxiety, but that the family system is very much part of the child's experience of anxiety as well, and is very key to effective treatment. A few more important considerations. I just listed a few questions here to ask yourself maybe about your own child or children that you work with. Is your child more anxious or shy than other children his or her age? Or do you notice that your child is more worried than other children his or her age? And I think so important for us to keep in mind that anxiety is one of the most common mental health disorders, but gets little attention, that it can be very sneaky. For example, many anxious children are people pleasers or perfectionists. They don't act out in class. And we note that that is, one of the most underdiagnosed and undertreated disorders, especially for children. And, to look at when is the anxiety problematic. Anxiety is a part of our physiological, neurological structure as a system to protect ourselves from perceived threats. So it's not all bad. But when it when it interferes or stops a child from engaging in things that are developmentally appropriate or engaging in important developmental tasks, there becomes a disruption in that child's development. Or if the anxiety caused such distress and it feels like the child feels it can't be controlled, then we would consider it problematic as interfering with life. It is developmentally appropriate, though, for a child to feel fears. There's a popular study of infants in developmental psychology who crawl to the edge of a visual cliff. And while they can't fall down, it looks like they could. And that fear of falling is innate for them, and they innately turn away from that perceived cliff and that perceived fear of falling. So it is developmentally appropriate, but our job is to help children to be attuned enough to children that we know when it becomes problematic for them, when it interrupts their development and their quality of life overall. All right, if we now kind of move on to looking at some general tips for caring for children who are experiencing anxiety. At the very top of the list, I can't emphasize enough how important it is to pay attention to your child's feelings, to explore them and to validate them with your child. That telling a child not to worry is just simply not effective. In fact, it's more likely to make a child feel more alone and abandoned, and therefore increase the severity of their anxious symptoms. And really, unfortunately, with anxiety, it won't just go away. Stay calm when your child becomes anxious, and that requires a great deal of mindfulness and awareness on our part as adults of our own anxieties and our own anxious triggers. Try to recognize and praise small accomplishments with your child, particularly relating to challenging fears of anxiety. And this is, again, if we take a look, this is part of that gradual desensitization and exposure process to challenge avoidant behaviors. Some parental traps and misconceptions in helping children overcome anxiety. I thought I would just cover a few of those, even though I don't have them listed here on our PowerPoint. But these are something we come up against often. That one is a misbelief is that parents or caregivers must protect children from anxiety. And in fact, the message that this gives to a child is that he or she can't cope with that anxiety. Instead, try to convey to your child the message that they are able to overcome that anxiety and that you as their caregiver will help guide them and will be there alongside of them to figure these hard things out. A second misconception is that if I acknowledge my child is really afraid, then I can't ask my child to develop skills to overcome their anxiety. I think for us, it can become very easy as adults to fall into the trap of denying or invalidating a child's emotional experience. And like the first bullet point on this slide, anxiety won't just go away. And ignoring it will actually probably increase the child's anxiety than help it go away. Third, a third misbelief is that a child's anxiety needs to be kept secret. This can't be further from the truth. Instead, I encourage you to seek out as much support as you need and to collaborate with other adults who are caring for your child or the child that you're caring for. It's so important for both caregiver and child to receive support and to collaborate. Support for children with anxiety means combining acknowledgement, acceptance, and legitimization of their anxiety to really be empathic to their emotional experience. It also means combining that empathy with confidence in a child's ability to cope with the expectation of slightly better and gradually building on their coping skills. Here are a few other general tips for parents and caregivers. Don't punish your child's mistakes or lack of progress in addressing their anxiety. Help them to build up their sense of self, their ability to conquer this, their ability to understand their anxiety. Be flexible with them and at the same time help them to maintain a consistent routine. Modify your expectations during more stressful periods, but also helping at the same time to engage your child in accessing their coping mechanisms. And help to plan for transitions, maybe giving extra time and extra time for practicing those coping skills together. So parenting your anxious child, again, just teaching your children and adolescents ways to manage anxiety increases the odds of building their positive self-esteem. Positive self-esteem is one of the greatest protective factors a child can have against major mental health struggles, peer conflict, academic struggles, substance use and abuse, just to name a few. And it's one of the best protective factors for overall life happiness. Here again are some bullet points about helping your anxious child address their anxiety. First and foremost, building up and nurturing your child's personal strengths, helping your child to foster independence and promote security. And this reminds me of just looking back on those avoidance behaviors. That oftentimes as caregivers, we try to accommodate a child's anxiety, maybe by not encouraging them to challenge it or wanting to protect them, again, falling into that misconception, protect them from their anxiety. But research shows that the likelihood of children overcoming anxiety disorders is dramatically reduced when we accommodate or enable a child's avoidance behaviors. And decreasing accommodation of those avoidance behaviors encourages a child's individual coping, including using their support system, increases a child's motivation for conquering those anxiety feelings, And all of those things need to be done supportively. We can't just throw our children to the wolves and ask them to figure it out on their own, but we can help build up their sense of self, their personal strengths, their independence. And if we can be alongside of a child in helping them to process and manage his or her own feelings, again, that empathy piece, that validation of their emotional experience, we have a great platform to begin addressing and challenging anxiety feelings. Keeping consistent expectations and building up expectations gradually is important, as well as setting consistent limits and consequences. Be wary of passing on your own fears or anxieties to children that you may parent or caregive. And collaborate with other adults for consistency in addressing these anxious behaviors. So that might be the child's daycare provider or school teacher or other parents that doesn't live in the home, or maybe grandparents, family members. And again, seek as much support as you feel you need, that you deserve the support as a caregiver of a child, especially with who's struggling with anxiety. So here are a few bullet points from the book Helping Your Anxious Child, which is a wonderful resource. All of these, we want to help the child to become more empowered to face anxiety and to tap into their own ideas for fighting anxiety, while simultaneously decreasing that activated neurophysiological state, that fight or flight response that I've talked about previously. So teaching by example, practicing those coping skills together, practicing breathing skills. With the progressive muscle relaxation, you could help a child to focus on melting away anxiety. They could visualize their anxiety as fire, and with the progressive muscle relaxation, think about pouring cold water over each part that's on fire. Maybe the child's belly feels anxious or their chest feels anxious. Helping to lead them in deep diaphragmatic breaths. This is one of the most powerful relaxation tools we have. A deep diaphragmatic breath sends a powerful signal to the brain of safety. This then disarms that activated neurophysiological state of the fight or flight response. Guided imagery and guided meditation are also incredibly powerful tools. Perhaps we could help a child think about their anxiety as a hot air balloon and watch it floating away. And be as creative as you like, as creative as your child wants to be with you. And the use of imagination is so powerful in decreasing anxiety because a child can use that imagination to then fight their imagined or perceived fears. They become the person in the driver's seat. They become empowered in this process. Okay, and to just emphasize here that relaxation is a skill, that it's something we have to practice, that we need to set aside time to create the habit, being attuned to what time is right for your child. Perhaps their anxiety comes up before bedtime or in the morning before going to school. Those are perfect times to set aside and really practice coping skills with your child or relaxation skills. Help create a relaxing environment for your child. Perhaps your child's room is full of electronics or is very busy with bright colors. Oftentimes, helping to change a child's environment using those 5 senses can help decrease some symptoms of anxiety. So perhaps adding some lavender spray or essential oil to your child's pillow at night, or to have a diffuser in the room, to take that TV out of their bedroom so that there isn't that extra stimulus, to play calming music or help them to have a special blankie that helps them to feel calm. Use praise and make learning these skills fun for your child, that it can be a game. Again, I'm going to emphasize the importance of that creativity piece, the imagination. And the more simple and short we can keep things for children, the better, and for us as their caregivers. Well, now we've gotten to the end of my PowerPoint, but I wanted to just emphasize these wonderful resources that we can have at our fingertips via our public library or the internet. This is a book I often recommend to parents, and I think it's a wonderful breakdown, more in-depth than what I did today. But Helping Your Anxious Child, the second edition, a step-by-step guide for parents. It was published in 2008. What to do when you worry too much. This is a kid's guide to overcoming anxiety. It's a really great workbook with great illustration that the child, it's at an elementary school reading level, so the child can work through it together with their parent or their caregiver. WorryWiseKids.org is another fantastic resource. It's the Children's Center for OCD and Anxiety. And then ADAA.org is Anxiety Association of America. And then again, just to give a plug for Yale University's Child Study Center, you can find their resource at yale.edu. You can also find some of their very informational and helpful videos on YouTube. So for any more information, please contact our Mercy Family Counseling. We're at 1340 Blairs Ferry Road in Hiawatha, and give us a call anytime, 398-6575. And I'm going to pass this back over to Lynn so we can hopefully answer some of your questions.
Well, thank you, Ellen. A lot of good information about an all too common problem, I'm afraid. To remind our viewers, your questions can be submitted from the box in the upper right-hand corner of your screen. And we have a number of questions that we're going to get right to here. First question, Ellen. My child has expressed worries about the tragedy at Sandy Hook occurring in Cedar Rapids. Can you give me some guidelines to discuss this with him?
Okay, well, this is a very difficult and painful tragedy for all of us to process through, adults and children alike. And it makes a lot of sense that children would be feeling more anxious, more worried about the possibility of a tragedy like this happening at school. I would encourage you to start with speaking with their classroom teacher, talking with him or her about what the conversation has been in their classroom, what things is the classroom preparing for in terms of safety, so that you all are on the same page. I would also encourage you to talk about this with your children and to talk about it in a developmentally appropriate way, that tragedies do happen in our world, that it's very sad and it can be very scary, that most people feel overwhelmed by a tragedy like this. To talk with them about reminding them of what are the safety plans in place at school, at home, how does that child feel safe, and encouraging them to remind themselves of those skills that they have, of reminding themselves that they do have the ability to feel safe. There are grown-ups in their world who want to help support them. And I would discourage, again, from the avoidant behavior that a lot of us can fall into, especially with something as tragic as Sandy Hook, that protecting that it's in fact a misconception to not talk about this, that it's misconception to think that it would be protecting your child by not talking about this with them. So.
All right, thank you. Next question. My daughter is anxious about school, and I think it may be caused by issues with her teacher. So how can I deal with this without alienating the teacher? Okay, probably a fairly common situation with school-age children.
Yeah, this is a great question. I think a place to start might be connecting with your guidance counselor at the school to share your concerns with that guidance counselor, and then to begin that dialogue with the teacher, sharing your concerns that your child has brought home from school, that maybe the teacher is overwhelmed and he or she isn't quite attuned to the needs of your child. That I'm sure if with some discussion you could feel out how that teacher might be responsive or not responsive to your feedback, to maybe engage with the child in a different way, or to look at other resources for the child in the classroom. And if that conversation falls flat, again, going back to the guidance counselor or maybe even the principal at your school and sharing those concerns.
Next question for you, Ellen. My son often complains about a tummy ache, and checking with the family doctor, she suggested it could be related to anxiety. Do I need a referral to be seen by a counselor?
No referral is needed, which is wonderful. So you can give Mercy Family Counseling a call. Our front desk is wonderful. The women up there are wonderful, and they will help you as much as they can get set up with a counselor as quickly as possible. And oftentimes with insurance, I recommend to people that they call their insurance to see if there's mental health coverage. And yeah, I would encourage you to be in touch with us anytime.
Okay. This next question, I believe, is coming from a teacher, Ellen. It says, how do you bring parents on board to seek therapy for a child rather than just relying on meds? You know, talking about the fact that the parents, which you alluded to, are part of that bigger picture of why the child is anxious. May have as much to do, as I'm reading over the question, as far as the parent-child interaction. So do you have any advice for teachers on that topic?
This is a wonderful question, and I think that's something that a lot of caregivers, teachers struggle with, about how to bring parents on board to seek therapy for the child and the family rather than just meds. But my hope would be if the child is connected with a medication provider who is prescribing to children, that provider would be aware of the impact of the family system on the overall well-being of the child, and that provider would recommend therapy as another treatment option alongside of that medication. Oftentimes, I think it is really hard to connect with parents and to help them know that you're on their side for the child. And if therapy was recommended and the parents are resistant, I'm seeing here in the chat box, perhaps communicating to the parents that of the behaviors that you see in school and your own experience as a teacher in a child's development, that unfortunately, we can't force anyone a parent to seek out therapy for their child unless it's court mandated. And so it leaves us feeling very powerless, and that can be incredibly difficult. And so I would recommend maybe sharing your own personal experience of working with the child, sharing what does work in your classroom, being calm, compassionate, helping the child to do the best that he or she can, and see if that would be a place to start. Mm-hmm.
Keeping those lines of communication going on, in other words, between the teacher and the parent and the child. Another question here, Ellen. My husband and I often disagree on our parenting styles. Can you give me guidelines to know when a parent is protecting, modeling behavior for a child versus enabling behavior?
Again, this is a great question. And I think if I'm understanding the question correctly, I guess if we take a look at avoidance behaviors, if we can understand what some of those avoidance behaviors are by a child and understand why that feeling is there for them, then that helps us to understand whether or not we're going to be enabling a child's anxious behavior or not. If the child is demanding to not go to school or demanding to not go to daycare and because they feel worried or they feel anxious, and we've made a healthy assessment that there isn't bullying at school or they are safe at their daycare, then we want to be able to help modeling for that child gradually, a bit at a time, that they can go for a bit and how is it feeling, and these are the supports you have. And I would always recommend, honestly, I would recommend being in touch with a child-centered therapist and discussing your parenting concerns with them so they can better help you sort through some of the complex nuances that come up between parents oftentimes. So, yeah.
Okay. This next question, I'm sure, will strike a chord with a lot of parents. My child gets anxious before trips and has a hard time falling asleep the night before. Do you have any ideas on how to help him fall asleep easier?
Again, great question. So it sounds like he has some anxiety with transitions or things that maybe feel uncertain to him. And so some ideas I would offer would be there's this great intervention called the worry box. And you create this worry box with your child. It can be a shoe box or a cereal box or whatever you want it to be. And they can design the outside, put pictures on it, whatever they want, make it their own. And maybe after dinner the night before, or you could even do it several days before instead of leaving it to the night before, helping him to recognize, okay, this transition is coming up, we're going on a trip. You were pretty worried last time this happened. Let's start talking about it now. Let's start talking about it a handful of days ahead of time. Validating and empathizing with him, but helping him to write down or draw out whatever is more comfortable for him, his worries. Maybe that's he won't know where to have lunch that day. Or maybe it's that he thinks the kids, any new kids he meets might not like him. And so he can write those down or draw those out and then put them into the worry box. And you together, you could start addressing those. So, helping him to work through problem-solving skills, if that seems appropriate. And also just helping him to let go of those worries, put them in the box, close the box. He can keep the box in his room at night if he wants, or you can take the box. I mean, it's a symbolic intervention, but parents seem to have a great deal of luck with this one.
And also perhaps the deep breathing exercises that you had mentioned before too, some of those characteristics. Okay, next question is, how does a parent help their child that has excessive thoughts of guilt and shame from mistakes they've made in the past? So in other words, how do they, help their child deal with issues of guilt and shame at their age?
This is, again, a great question, and a complicated one, I think. that those excessive thoughts of guilt and shame are very complex and oftentimes take quite a bit of time to unravel together. A place one could start would be focusing on helping the child to remember their strengths, the things that are good that they have done or that they feel about themselves, helping them to develop that positive sense of self-regard. But also perhaps giving them a safe and neutral place with a therapist or counselor to explore why those feelings of guilt and shame are so deeply in place. That I really feel like this would be a prime example of a great candidate for play therapy, perhaps, in that just slow uncovering of these beliefs about themselves, and then also a way for a parent to receive support around how to continue to address these with the child, a place to perhaps process their own shame and guilt about mistakes that parent has made in the past that are being transferred to the child. Again, complex, but certainly treatable. And so I would just encourage a focus on that, helping the child to develop positive self-regard, and again, reaching out for additional support for both the parent and the child.
Now, a tape of this program will be available on the website listed on your screen, www.mercycare.org/live, or if you're familiar with Mercy's website, if you go right to the Family Counseling Services, and we have a listing of this website as well as all additional previous webinars that have gone on. Now, our next topic is chronic kidney disease with Dr. Fadi Yacoub, Internist Associates of Iowa and medical director for Mercy Dialysis. His webinar will be Thursday, March 14th at noon, and he also will take questions live after the discussion. Then we'd like you to be sure and mark your calendars for the April webinar. The topic is Adverse Childhood Experiences. This is a fairly new term, and I'm going to ask Ellen, since she's right here, to just in a nutshell tell us what this will be about.
This is a really exciting new perspective and research that's going on across the country, actually, and started in the Harvard Center for the Developing Child. And anyway, one of the lead researchers, Dr. Anda, is actually going to be here at Mercy Medical Center on March 25th, and it's free. And basically, adverse childhood experiences are 9 factors that contribute significantly to struggles later in life. They're experiences that a child has, obviously, in their childhood, and they're incidents that dramatically upset the safe, nurturing environment that children need to thrive, and that generally are understood as harming child's development socially, cognitively, behaviorally, and emotionally. And that what we're finding is that these ACEs are strongly associated with later life health problems, physical and mental health. And the more exposure that a child has to these experiences, the more difficult our adult life is. So with ACEs, the idea is that we really begin to focus a lot more on preventative mental health care, and so that will follow through into our medical health or physical health. And I just got a question here on the chat. Where can we find the information for the doctor visit on March 25th? I would recommend giving Mercy Family Counseling a call. And our number is 398-6575. Otherwise, you can give United Way of East Central Iowa a call too, and I don't have their number in front of me, but they are one of the major sponsors of the event and are very involved in our Iowa's participation in the national movement. So, thank you.
Now, if you're interested in learning about future Mercy webinars or other events, you can sign up for Mercy's electronic newsletter at www.mercycare.org/e-news. Now, I believe we have covered all the questions that have been submitted to us, but if you have additional concerns or questions, Ellen can be reached at 319-398-6575. And you will also receive a follow-up email. And if you have any questions or concerns, please, feel free to respond to me through that way also. Well, thank you all for joining us today.